Good morning and welcome to the latest installment of Treasure Coast Business Disaster Relief and Recovery, brought to you by the Virtual Business Recovery Center and the Corporate and Community Training Institute at Indian River State College. This webinar is sponsored by the Florida Small Business Development Center, hosted at IRSC, and the Economic Development Council of St. Lucie County. You may post any questions and comments in either the chat room or Q&A area of this virtual meeting room. Today, we're going to talk about coronavirus and charities, insights on how COVID-19 is affecting the nonprofit community, led by CCTI instructor, Tom Epsky. With that being said, I'm going to go ahead and pass it over to Tom.
Thank you, Katie. Well, welcome everyone to today's webinar, hosted by the Virtual Business Recovery Center and our partners, the St. Lucie Economic Development Council, Indian River State College, and our local Small Business Development Center. I am Tom Epsky. I have the honor of serving the citizens of Florida as a commissioner on the Florida Reemployment Assistance Appeals Commission. The commission is a quasi-judicial tribunal that acts as a court of appeal for contested reemployment assistance cases and generally involves workplace misconduct, employee relations issues such as wage and hour violations, harassment and discrimination, and sometimes unilateral and material changes in the workplace. I'm also an adjunct professor at Indian River State College, teaching classes in human resources, management, and legal issues. But my favorite role is as a volunteer. I was fortunate to grow up in a family which instilled the values of service to one's community. And through the years, I have been a volunteer board member with Hospice, Big Brothers Big Sisters, and our local United Way. I currently serve as a member of the Board of Governors for the United Way of Florida. Today, we are discussing the coronavirus and its impact on the nonprofit community. Specifically, I will address some common issues arising from the COVID-19 pandemic that are directly affecting non-for-profit organizations. Now, each organization is unique and may have different concerns and impact. I will have time at the end for questions, so please be sure to type those in the comment or the Q&A box. So VUCA is an acronym that was first used, I think, in the late 1980s, based on the leadership theories of Bennis and Nannis, and it stands for volatility, uncertainty, complexity, and ambiguity. It was the response of the U.S. Army War College to the collapse of the USSR in the early 1990s. And suddenly, there was no longer the only enemy, resulting in new ways of seeing and reacting. And through the years, the concept has been adopted to the world of business in light of contemporary environment and the leadership required to navigate it successfully. VUCA is a catch-all for, hey, it's crazy out there. And for most of us, I think the COVID-19 crisis clearly fits the bill. Volatility refers to the speed, the volume, the nature, the magnitude of a phenomenon that may or may not be a pattern form. Volatility increases complexity. And complexity describes the number of different states of a system one can get into at a certain point in time. The amount of states in the system that one can get into, the higher its complexity and the harder it is to manage it. Of course, uncertainty occurs when there are no concrete trends or patterns with which to make it have an established pattern to be able to base decisions on. And ambiguity describes a situation where multiple interpretations are permitted and equally valid. This makes it hard to decide what to do in order to achieve the desired outcome. Well, thanks to COVID-19, we've all been bombarded by mostly unwelcome outcomes of events unfolding in what I like to think are nonlinear ways. A nonlinear system in math and science is one where change in output is not proportional to the input. So in this kind of system, twice the time or double the production doesn't equate to twice as much output. Now, this is truly mind-boggling for those grounded in rational linear thinking. But nonlinearity occurs a lot more than we appreciate and therefore accommodate. Every day, complex systems which describe our modern world have nonlinear as one of its characteristics. For not-for-profit organizations, this takes on a completely new light. For example, many of us pondered some of the COVID-19 curves that have been broadcast, projected rates of infection, hospitalization, ventilator requirements, and death based on types of response taken to fight the virus. Like many others, you may also have wondered why those rates varied amongst jurisdictions. In the US, states and cities are compared. We read daily announcements and comparisons of the differing outcomes for various counties in Florida. Lots and lots of curves at once, many similarities and many differences. Another characteristic of complexity. At its core, complexity occurs because numerous factors interact, frequently through interrelationships that are difficult to pinpoint and challenging to predict. We may understand part of a system based on its history, but we all have to be aware that past performance is no longer a reliable indicator of future performance. Let me repeat that. Past performance is no longer a reliable indicator of future performance. Now, you may have heard or read that caution many times before, but not given it much thought. For a nonprofit organization, it's critical to apply this warning to most of its world, made up of systems within systems. All of these are complex and carry the same caution. Since we've already looked briefly at complexity, let's just take a quick look at the other terms. Volatility. Volatility is about change in the system, both the rate of change and the impact of any particular change. In the pandemic, we have both high rates of change and quite variable outcomes from prospective initiatives. A journalist named Jessica Irvine wrote, "Pity the authors of economics textbooks. Every day of the COVID-19 crisis, it becomes necessary to rip out a new page and start again." We should get used to new courses of action being taken based on the emergent data of yesterday. Last week is well past its use-by date. Uncertainty in COVID-19 context means that predictability is low. Who would have imagined that toilet paper would become a proxy for uncertainty and fear? In some places, there is a huge increase in sales of firearms and ammunition. We haven't even mentioned the medical uncertainties connected with the pandemic, such as who will get it, and how will it impact individuals, what vaccine will work, how long will it take. Surprises are a matter of course, and thankfully, some may be positive. Ambiguity abounds. Recently, you may have heard or even had some of the following thoughts. I had a cold or flu-like symptoms. Do I have the virus? Can I get tested? Those cruise ships that were off the coast of Fort Lauderdale that came into port a few weeks ago. Many of us thought, hey, geez, the crew, and with no ports to call home, will the sick claim the scarce ICU beds we're hearing about and, take up ventilators in Florida ahead of our population if it came to that? All of these and many others illustrate the ambiguous challenges of this COVID-19 complex. Luckily, most business climates, including the ones created by the coronavirus, are not volatile, uncertain, complex, and ambiguous at all time. So being able to identify which one describes your climate is critical to understanding what the most effective response may be. So as a nonprofit, how should we be responding to the coronavirus pandemic? Are there specific policies and procedures that we should put into place? I think that's a very fair question. In these uncertain times, it's best to be as prepared as possible. Crisis management is difficult under normal circumstances. And with a crisis of this magnitude, it's even harder to predict what policies and procedures you should have in place. Let's take a look at two elements nonprofit organizations should consider in light of COVID-19 and our VUCA world: crisis planning and key policies that should be included or considered. So crisis and disaster planning. The very nature of crisis and disasters is that they are unplanned, unexpected, and have serious impact on people, organizations, and communities. In the United States, recent examples include 9/11, terrorist attacks, Hurricane Katrina, Superstorm Sandy, Category 5 tornadoes, and other natural disasters. Around the world, we see armed struggles, terrorism, and other man-made and natural events, and the upheaval that they produce. These events, along with COVID-19, capture our attention and bring community members to action as volunteers and donors, and remind us that emergencies and devastation can come at any time, at any place. Many businesses, corporations, and government agencies and other entities have designed a variety of resources, tools, plans, and actions to guide their response to crisis and disasters. And some of these examples are what we're going to talk about today. Generally, emergencies can affect 5 key areas: physical or psychological injury to people, inability to continue important organizational operations, damage to or destruction of facilities, financial loss, apart from those of the above, and spillover effects from something that has affected some other person or the organization. Nonprofits occupy a key role in the response to disasters. Nonprofits are often at the forefront of supporting those affected by disasters. Agencies such as disaster and relief organizations, hospitals, health and human service organizations, food and housing organizations, and animal rescues are part of first responder teams in many emergencies. And many of these organizations to continue to provide support long after the immediate event. Maintaining the nonprofit's health and strength and capacity to serve others is, of course, vital to their community and constituents. Nonprofits also hold a unique place in the public trust and often come under immense media scrutiny. Crises such as financial or ethical improprieties on the part of a member of an organization can seriously damage its reputation or its ability to continue to provide services. Even irresponsible actions by others in our fields or in the larger nonprofit sector can have a negative spillover impact on our organization. So a proactive approach to addressing these issues will help us come out on top after a crisis. And then we have the KSA. We call that the knowledge, skills, and abilities. Safeguarding knowledge, skills, relationships, passions, and creativity is human resource is an essential component for every organization. In the nonprofit sector, the contribution of the board and staff are even more critical. Many nonprofits operate with just a small group of leaders, often playing multiple roles. The unexpected loss of any member of an organizational leadership team presents a challenge for nonprofits, and the potential loss of several key leaders in a disaster situation can produce a major crisis for many nonprofits. So in dealing with crisis, we need to look to crisis management. It's defined as an organization's pre-established activities and guidelines for preparing and responding to significant catastrophic events or incidents in a safe and effective manner. So we need to, as a nonprofit, ensure that we have a robust crisis and disaster plan. This is a key tool that documents the actions the organization will take in the event of a significant event, a crisis like COVID-19, or a disaster. Benefits of a crisis and disaster plan include the focus on crisis and disaster planning to ensure preparation for emergencies to the best extent possible, responding quickly and clearly to all constituents, continuing to be able to offer your essential programs, resuming full operations as soon as possible, and safeguarding and protecting vital organizational resources. The risks of not addressing these types of issues, well, without a crisis and disaster plan, during and after, a nonprofit may not be able to provide essential services, generate earned and philanthropic revenue, retain or replace key organizational leaders, as I said, avoid negative media attention, to be able to safeguard its intellectual property, and therefore it may not be able to maintain the public trust and confidence. Let's take a look at some of the components that every nonprofit should include in a crisis and disaster plan. Now, I'm just going to speak briefly about these components because depending on the type of work or service that your organization provides and the environment in which you work, you may find that the components of your specific crisis and disaster plan may need to be more highly developed in some areas than others. You may also find that your organization requires additional components to adequately prepare for disasters. If you're interested in more information, please be sure to comment, and we may develop a webinar on just a crisis and disaster plan development. It may also be helpful to reach out to other similar organizations working in your field or your region to explore and to compare disaster and crisis planning approaches. The first step is to define the purpose, priorities, and principles. Start your plan with an explanation of why and how the crisis and disaster plan is relevant to your organization, its mission, and the people you serve. This communicates the organizational commitment to addressing crisis situations in a focused and efficient way that safeguards the mission and assets held in the public trust. Next, designate the response team. The response team provides the structure. It establishes the principles and implements the policies for action in the event of an emergency. The plan describes roles and responsibilities of team members and provides up-to-date contact information for the individuals involved. Then it's important to assess your risk through different types of crisis and disasters. Events may occur that are either external or internal to the organization, or both, and will have a serious impact on your capacity. Take into consideration your location, the community, and program focus in defining and prioritizing the risks that are most relevant to you. And then develop the business continuity plan. Business continuity planning addresses the following areas: preparation, which are actions taken prior to a crisis or disaster; response, procedures and steps done immediately after an emergency or where there's been an interruption to business; and recovery, restoration, the steps taken to restore functionality so that some level of mission-driven service can be offered to clients while restoring the organization to its original status. The business continuity plan is an important tool, and its development will depend upon many factors, including but not limited to the mission of the organization, the services provided, and the communities served. Now, we answered the question earlier how a nonprofit should be responding to the current COVID-19 pandemic by illustrating planning and policies. As you develop your plan, it's likely that you will begin to see the connections between crisis and disaster planning and the policies, procedures, and operational plans that your organization already has in place during non-disaster times. In some cases, a strong and well-planned systematic response can lessen the impact of a crisis or disaster. An established and well-functioning system of crisis and disaster response can make for a much quicker response and ease tensions and anxieties about an unexpected event. The development of your crisis and disaster plan should include a review of all related systems, plans, and procedures that include your board, your staff, and your volunteer policies, your program and service standards and compliance, your insurance and risk management policies, your IT recovery and cybersecurity policies, how you're going to communicate and use your social media policies, looking at financial policies, including internal controls, purchasing reserves, policies, or uncovering improprieties, succession planning and leadership development, as well as resource development plans. Let's take a look at some of the specific policies that a nonprofit should be looking at in the wake of the COVID-19 pandemic. First is staff leave. You might want to review your sick time and personal leave policies. If you have not already done so, you will definitely want to adjust these policies to reflect the requirements from the Families First Corona Response Act. Now let me spend some time just going over the FFCRA and the paid leave requirements. The Families First Corona Response Act requires certain employers to provide their employees with paid sick leave or expanded family and medical leave for specified reasons related to COVID-19. The Department of Labor, Wage and Hour Division administers and enforces the new law's paid leave requirements. And these provisions will apply from the effective date through December 31st, 2020. Now, generally, the Act provides that covered employers, and we'll talk about that in a minute, but that covered employers must provide to all employees 2 weeks, up to 80 hours, of paid sick leave at the employee's regular rate of pay where the employee is unable to work because the employee is quarantined, and that's pursuant to any federal, state, or local government order or the advice of a healthcare provider, and/or is experiencing COVID-19 symptoms and seeking a medical dosage. Or the Act provides that employers must provide 2 weeks, up to 80 hours, of paid sick leave at 2/3 the employee's regular rate of pay. And those are for cases where the employee is unable to work because of a bona fide need to care for an individual subject to quarantine, again, pursuant to federal, state, or local government order or the advice of a healthcare provider. Or childcare for a child under 18 years of age whose school or childcare provider is closed or unavailable for reasons related to COVID-19. And/or the employee is experiencing a substantially similar condition as specified by the Secretary of Health and Human Services. Now, a covered employer must provide to employees that it has employed for the last 30 days. This is a significant departure to the regular Family and Medical Leave Act. But for those that have been employed for at least 30 days, an employer may also have to provide up to an additional 10 weeks of paid extended family and medical leave at 2/3 the employee's regular rate of pay where an employee is unable to work due to a bona fide need for leave to care for a child whose school or child care provider is closed or unavailable for reasons related to COVID-19. Employer notice. Each covered employer must post in a conspicuous place on its premises a notice of the FFCRA requirements. So make sure that you have a notice similar to the wage and hour, sexual harassment, and discrimination posters that are already required in the workplace. Make sure the FFCRA update is part of that posting. Employers may not discharge, discipline, or otherwise discriminate against an employee who takes paid sick leave under the FFCRA and files a complaint or institutes a proceedings under or related to the FFCRA. Now, who's covered by this? Well, the paid sick leave and expanded Family and Medical Leave Act provisions of the FFCRA apply to certain public employers and private employers with fewer than 500 employees. Yep, that's what I said. Private employees who work for an organization who have up to 500 employees. Now, small business, including nonprofits, with fewer than 50 employees may qualify for exemption from the requirement to provide leave due to school closings and childcare unavailability if the leave requirement would jeopardize the viability of the business as an ongoing concern. That is a question that you would want to have with your legal counsel before trying to make a decision on excluding somebody who the law broadly wants to cover. Now, of course, there's lots of penalties and fines and enforcement mechanisms that go into that. We can certainly discuss in a different webinar a lot more about the Family First Coronavirus Relief Act. But let's take a look going back to some of the other policies. Remote work. By now, with the Safer at Home order issued by the governor, our organization probably has something in place, maybe has already conducted a lot of its work remotely. But now revisiting your personnel policies and procedures to specifically codify a remote workers policy will be helpful in keeping your staff safe and ensure your business operations and services continue. We also need to look at our internal controls in light of coronavirus. Nonprofits, and especially their boards, should already have internal control policies in place, but these will probably change with COVID-19. So things to consider include how to adapt your internal controls during remote work and social distancing. So we need to make sure that we're working on those policies. Programs and services. A policy like this should consider how you will continue to provide services to those that you serve. During COVID-19, this could include how the organization will address safety concerns and basic operational needs, as well as how to ensure you are giving accurate and timely information and instructions for those individuals and communicates that need it. Consider how you will keep your employees and members safe, what the system will look like, how you will communicate to staff and stakeholders and members, the change in services. The COVID-19 virus has fundamentally altered many of our operations and mission statements. So as a nonprofit, we may need to go back and revisit what we were doing and to look at engaging in those services and programs that are absolutely top tier, best in class, that nobody else in the community is doing. But those that were marginally successful, maybe we need to look at no longer continuing them or partnering with a kindred organization that would be able to have a collaborative effort to address those concerns. This is going to be especially something you have to evaluate with diminished contributions and donations to the organization, which we'll look at. Communications and social media policies. Everybody's world has been reset. And so we need to look at our internal and external communications, particularly with staff and stakeholders, the board, the community, those that we serve. During this time, you might want to consider how you are providing information, including what's happening at your organization and whether or not you're sending out external resources to keep your community informed as the situation continues to evolve. Look at a detailed policy in what could be included now in a more robust social media stance. And then cyber and security IT. With staff now working remotely, definitely consider how you will safeguard your organization's information. We've all seen the horror stories about government employees at the IRS or the Department of Defense having laptops stolen from their cars, which contain social security numbers and private healthcare information about military personnel. So you should definitely have a cybersecurity and IT policy that covers what resources you will need to make remote working sustainable. There are other policies you can consider, like resource development policies, but these are conversations you should be having with your board. You should look through the first list as we see here, compare it to the policies that you already have in place, and then see if it's possible that you need to adapt many of these in light of COVID-19. Engage your board in a discussion around your organization and what it needs at the moment and what it will need in the future. Just wanted to talk a little bit about a policy which is applicable to nonprofits, and that's the Fair Labor Standards Act. Sometimes we know it as the FLSA or the Wage and Hour Law. And this is the policy that establishes minimum wage, overtime pay, among other things like youth employment and record keeping. All nonprofits have to meet the standards of the Fair Labor Standards Act. And one of the concerns that I have in being a member of the nonprofit community and board service is how sometimes we misclassify workers. We have, of course, exempt and non-exempt categories of workers. It's an important distinction because exempt employees are generally paid on a salary basis, but there's a very narrow exclusion for considering somebody an exempt employee versus a non-exempt. You have to meet exempt duties job tests and pay people on a salary basis. Now, of course, on January 1st, the Department of Labor increased the minimum salary, the first prong of our test to determine whether somebody's eligible to be exempt. And they increased that to having a salary of $684 a week or $35,568 a year. So that means as a nonprofit, if you have an employee that you consider exempt and they're not making at least $35,568 a year, you're in violation of the Wage and Hour Law. Broadly, the law and the federal government want to classify employees as non-exempt. And the reason for that is because non-exempt employees are entitled to overtime if they work more than 40 hours in a work week. So if anybody is being paid less than that $35,568 a year, then they must be non-exempt employees, and you have to pay them an hourly rate of pay, and they're subject to overtime. Now, part of the FLSA as well is the minimum wage law. Now, Florida is unique, as several states have done, and passed its own minimum wage law, which is tied to inflation. On January 1st, our minimum wage increased to $8.56 an hour. Now, this is sometimes problematic for a nonprofit because in wake of a disaster or a pandemic like COVID-19, sometimes grant opportunities come down from the federal government in which it says you can hire workers minimum wage. We need to make sure that we're paying at least that $8.56 per hour for all of our workers. Let's take a look at philanthropy now. COVID-19 and philanthropy. How has donor behaviors shifted amongst the pandemic issues? In the span of only a few weeks, the COVID-19 pandemic has literally upended daily routines and impacted communities across the world in unprecedented ways. I would dare to say no corner of our society has been left untouched by the effects of the pandemic, including the nonprofit sector. To understand how this pandemic could impact the nonprofit community, Fidelity Charitable conducted a survey of philanthropic individuals to see how they're thinking about philanthropy in response to the pandemic and how the situation could affect their giving and volunteering behaviors. And this study underscored the following takeaways. One, most donors plan to maintain or even increase the amount they donate to charity this year. Support from donors is needed to obviously sustain nonprofits at any time, but is particularly critical in a time of crisis. The Fidelity Charitable Survey found good news for the nonprofit sector. A quarter of donors plan to increase the donations in response to COVID-19, while 54% plan to maintain their giving levels. Younger generations plan to step up their donations in greater numbers. So as you're developing your marketing plans, think about that. 46% of millennials say they will give more in response to the pandemic, compared to 14% of baby boomers and 25% of Gen X. Of those who say they will decrease their donations to charity, it's generally a concern over the recession and the economy in general as being a top trigger. Now, in light of this information, I don't mean to be the rain from the silver lining cloud, but where 46% of millennials say they are planning to step up, this generation, we have to understand, is being hit the hardest in job loss. This is a generation with the largest share of workers in sectors hit most significantly by COVID-19, like leisure and retail, healthcare, social services, admin. And so layoffs, furloughs, and wage cuts due to the pandemic may diminish these numbers somewhat. Now, in contrast to charitable giving, volunteer activity is likely to dramatically decrease due to the pandemic. State and local governments are urging residents to stay home as much as possible to prevent the spread of the virus. This creates challenges for many nonprofits who rely on volunteers to deliver critical services. Nearly half, about 47%, of recent volunteers believe the amount of time they volunteer will decrease or stop entirely because of the pandemic. Older donors are more likely to say that their volunteering will decrease, say 61% of the silent generation and 57% of baby boomers, while 20% of Gen Xers say they expect that their volunteer time may actually increase. Most donors don't plan to shift their giving to different organizations in light of the pandemic. So the good news is they plan to stay the course by continuing to support their favorite nonprofits. Many donors plan to continue supporting their usual charities, even amidst the pandemic. 43% in this survey said that they will continue to donate to the nonprofits they supported before, as they'll probably be impacted by COVID-19 in some way. So think about your marketing strategy again, reaching your donors and letting them know how you've been impacted. 25% of donors say they will give to different organizations as a result of the pandemic, however, shifting part or all of their donations to organizations that are specifically addressing COVID-19 issues in their community. Donors right now are most concerned about the way that COVID-19 could impact the ability of health and human services related nonprofits in being able to do their work. But concern is high also for organizations in all charitable sectors. Now, this was interesting to me. Many donors in this survey felt that they haven't gotten the information they need to effectively support efforts to combat COVID-19. Many donors are not sure how they can effectively address the impact of the coronavirus with their contributions. In fact, 1/3 of respondents said they don't even have any information that they need to understand where they can direct their support effectively. Older generations feel particularly unsure how to direct their donations, with 35% of baby boomers saying they don't have enough information versus 27% of millennials. So marketing and information is critical right now. Now, the impact that the COVID-19 pandemic is having on the economy is undeniable. Just in the first couple of weeks in March, nearly 3.3 million people filed for first-time unemployment claims. We're looking at numbers close to 30 million that have been affected. And unfortunately, the total number of people receiving unemployment is only expected to grow. Because things are likely to get worse before they get better, as a nonprofit, you may be faced with the difficult task of having to lay off some employees. Layoffs are hard for everyone, especially when the reasons for layoffs happen right now and are completely out of your control. But no matter when or why you have to lay off staff, it's important to handle the process professionally, which absolutely includes compassion, kindness, and understanding, along with the legal aspects of layoffs. So what I'd like to offer are, while understandably layoffs are the quickest way to cut costs, they are also the most painful. Before you start laying off, consider some alternatives if possible. Can you maybe cut employees' hours, eliminate overtime or cut it out, hold off on raises or bonuses, and furlough staff instead? Now, while likely you won't save much money compared to laying off staff, choosing one of these alternatives may actually be a better choice. You'll save money, but still keep staff employed. In turn, your staff will be grateful that you were able to save their job, which hopefully fosters loyalty to your company and brand. If, however, you determine that laying off employees is your only option, definitely take some time to create a comprehensive layoff plan. You'll need to consider not only the legal aspects of laying off employees, but the right way to communicate it. Legally, we have to check for protected classes. While it's easy to assume that you're being blind when you choose to lay off someone, we're eliminating a department or eliminating a position, make sure your decisions don't result in laying off a disproportionate amount of staff in a protected class. And protected classes can include older workers, generally those 40 and older, those with disabilities, minority races. For example, it may seem that more female employees are being laid off than males. Make sure this is not the case. Determine the total percentage of male to female employees, then see if your list of employees to layoffs have a greater percentage of distribution for males over females. You may need some extra help with this. No two layoffs are ever the same. In some cases, you may be forced to lay off employees who possess institutional knowledge. You don't want to lose that knowledge. However, there's nothing you can do to stop that person from being laid off. So consider what will happen if long-term employees leave and take their knowledge with them. As part of your layoff plan, consider asking those people to pass their knowledge on to people who are not being laid off. But don't be surprised if people aren't exactly open to your request. You'll likely have to offer an incentive for these people to stay on and train those who are not being laid off. But it could make a huge difference to the future of your agency if you can retain that knowledge and share it with remaining employees. Definitely consider the impact on remaining staff. Try to think about the staff that isn't laid off. While they may be likely to have gratitude, there may still be a harboring of fears and concerns that impact their ability to work. For example, remaining employees might worry about picking up extra slack or even resent that they have to do 2 jobs now with no extra pay. So you want to have a robust internal communication plan, making sure that you deliver what could be devastating news in a way that is sending the message for the viability and also care and compassion of the employee. If not, you could end up looking unprofessional and likely that you don't care about people who work for you. So the last thing you want to do is tarnish your brand. So before you announce anything, make sure you create a very detailed plan and check your legal requirements. If nothing else, a coordinated message helps to ensure that no misinformation or gossip spreads. And be kind and empathetic. While it may not be avoidable, employers should avoid laying off employees unless there are extreme situations. And be aware of when you're doing it. Certainly not the week before a holiday break or not on a Monday or Friday. And I get, from an HR background, opinions are divided on this. Some say Tuesday's better. Some say Wednesday, Thursday is second best. But, at the end of the day, employees who have been laid off report that once they were told, they couldn't process any more information. It's like, what their severance may look like or what their COBRA eligibility may be. So laying off somebody on a Tuesday, you're still open for the rest of the week. So by the time Thursday or Friday rolls around, the laid off person can maybe contact you and have a clearer head, an idea of what options are best for them. Sometimes I just wanted to bring this up. We're relying on our executive committees more. As the name implies, an executive committee has some special responsibilities and authorities above all other committees. Usually it can act on behalf of the full board, but there's limitations on that. Its main purpose is to facilitate decision between board meetings or in urgent and crisis situations. However, there are certain limitations of an executive committee. So you do need to look at your bylaws and understand what role the executive committee is defined to have, especially what it cannot do. So you don't want to delegate essential powers away from the full board. I have seen in my career too many times where an executive committee has made decisions like amending bylaws or removing board members or hiring or firing the CEO or making budget approvals, all decisions that only a full board should make. Major structural decisions like eliminating programs or approving mergers are things that a full board only should be making. So some decisions that may warrant the executive committee, especially if the board is too large, a smaller group can act on certain things. Maybe the board members are scattered. Right now, it's hard to come together for meetings. I understand that. But decision-making is already efficient with your full board, then go with the full board. But be careful how you use executive committees. An organization is well served by an executive committee, but when the committee is facilitating the board's time management. However, some special concerns I have is that we need to keep every board member active and responsible for their own participation. So, be responsive to the limitations of an executive committee. I know many nonprofits are using them more and more, but while they shouldn't be marginalized, we need to consider the full board. And if the committee especially is perceived, and I've seen this sometimes, perceived as an inner clique, outside members can feel very easily left out, resulting in poor morale and a loss of your key volunteers. All right, just to start wrapping up, one of the things that I think that many organizations are now using is virtual meetings. I'll be the first to tell you I was terrible at virtual meetings, but they usually involve conference calls where we could dial into a conference and be kind of unanimous, or kind of in the background, if you will, not being really fully visual and focused. It's hard to speak up. Sometimes that was on purpose. Sometimes that was the limitation of the call. But board members, in light of GoToMeeting and Zoom and Microsoft Teams, have an opportunity where they can treat each and every virtual meeting with the same respect of preparation and engagement and staying in the moment. It provides some really wonderful opportunities, especially where social distancing may not allow us to come together. I know from experience that sometimes board members don't give virtual meetings the same amount of preparation time and attention that they would give to in-person meetings. Why this is? I think it's because they've come to expect a less than robust conversation. So, and maybe we've seen some of those YouTube videos where, virtual meetings go amok. Take a look at some of them. Barking dogs, confusion about who's speaking, a lack of clarity about when a person is or isn't on the call. It's sometimes entertaining to watch, and it's a useful tool worth sharing with the board to get ahead of the matter and show them what can go wrong and some of the challenges. But as a nonprofit, in light of COVID-19, definitely consider the positive features of virtual meetings, cost savings, environmental impact, reducing air and automobile travel, the convenience, maybe engaging more board members who are otherwise busy in their professional endeavors, gives them the opportunity of not having to commute to your location, increases attendance and efficiency many times. Of course, there are many challenges. So virtual meetings definitely force board members to change expectations and alter habits. But there's a lot of demand too. So you need to have a chair or leader of the meeting that is versed in engagement and facilitation in this new way of meeting, and that they assuage the personal comfort levels of board members, especially in the absence of nonverbal communication and those that may not have as much technology awareness in some cases as well. All right, well, that was some thoughts. I know we try to keep this to an hour, and I wanted to leave some time to questions that others may have. One of the questions, how can a nonprofit keep up in this volatile, uncertain, complex, and ambiguous environment without confusing their clients, employees, and patrons? Well, that's a really great question. And depending on your mission, I think right now it's all about the clarity and consistency of communication. How are we touching each of our stakeholders? And by stakeholders, I mean the clients that we're serving. How are we touching our employees and our donors? We need to keep them in the loop about where we're focusing our mission in light of decreased donations and charitable giving, if it's affecting your organization. How you've made some adjustments to your staffing patterns, what this may look like for capacity and service delivery, maybe reduction in some services that were expected of your organization. So again, it's all about the communication. I know we've had some past webinars on the marketing plan. They are being uploaded to the St. Lucie EDC website. So please look at those, and there'll be some valuable resources. If there are topics such as how to communicate more effectively, looking at developing in a more detailed manner the crisis and disaster plans, please make sure you comment on that so we can include that in some future webinars. If you are interested in further resources, here's some valuable websites. The Virtual Business Recovery Center, which is part of the St. Lucie Economic Development Council, youredc.com, the Small Business Development Center and the Corporate and Community Training Institute at IRSC can be reached at irscbiz, that's biz.com. And then, of course, if you have any follow-up questions for me, please feel free to email directly at the college website, tepsky@irsc.edu. I'd like to thank you for your time and attention, taking your valuable time in wake of the virus to listen to this webinar, and know that there are many community partners, the United Way, the Small Business Development Center, the Corporate and Community Training Institute, the St. Lucie EDC, which are here to help you and your nonprofit at this time. So thank you all so much, and we'll look forward to seeing you on a future website very soon.
Thank you, Tom, and thank you again, everyone, for joining us today. Please come back next Wednesday, June 10th at 10 a.m., where we will be discussing a boom in online shopping and how you can set up your own e-commerce website. Again, that's Wednesday, June 10th at 10 a.m. We have webinars every Wednesday and Thursday at 10 and 2 p.m. The registration link for the e-commerce webinar is posted in the chat room. Thank you, and stay safe.